So, when I was born in 1996, my parents spent 15,000 Indian rupees on hospital fees. They wanted to ensure that their firstborn got the best medical services possible. So this 15,000 Indian rupees entailed a private hospital suite with a 24-hour birth attendant and newly introduced photolight therapy for my jaundice. And unfortunately, this is not a reality for a majority of the world's population, including even my younger sibling, who, 3 years later, and due to financial constraints of the time, was born in a more modest public health care setting for only a fraction of the cost, 3% of what was expended. And when you apply the exchange rate and the interest rates, you have 690 Canadian dollars spent on my birth, while only 17 Canadian dollars expended on his birth. And why is this? Why is it that some children are born in state-of-the-art medical facilities, while some aren't even privileged enough to have a sanitized room? And why is it that some are born under the supervision of medical professionals, while others are lucky when they have elderly women in the town or the village that can't address their complications when they arise? And lastly, what's most alarming is why are those that are born in the medical facilities much more likely to survive? And if you don't believe me, here are some statistics from a prominent institution in global health, the World Health Organization. A lot of the audience might like stats, a lot of the audience might not like stats, but I think the middle one is quite alarming. Children who die within the first 28 days of birth suffer from conditions and diseases associated with a lack of quality of care at birth or skilled care and treatment immediately after birth. So this is a facility and healthcare professional problem. Now, if we actually go back to the whys, so our cells are similar. Physiologically, we all require the same oxygen. Our organs function in a similar manner, if not identically. But why do these inequalities still exist? Why are some likely to survive, some not likely to survive? This answer is so complex, and I've spent the past 4 years trying to understand it in my degree here, learning from world-class scholars, courses after courses, readings after readings. And the next 5 minutes are probably not sufficient in trying to get that answer to you. But if I could bring 3 things to you, they would be here. Number 1, our environment shapes our health. Number 2, social inequalities result in health inequalities. And number 3, health is a privilege, not yet a right. So let's start with the first bit. Our environment shapes our health. And here I can start off with an example. I can finish this talk today, and on my way home to the bus stop, there is a raised step that I'll trip over. I'll trip, I'll fall, I'll hurt myself to the point where my brain will hit the walls of my skull. And the next few days are a bit difficult for me. I'm dizzy, I might vomit, but my parents and my friend group, the great support system I have, they'll notice that these symptoms are alarming and I should definitely get them checked out. I take their advice, walk into a regional health facility, which are very conveniently located for where I live, and have it checked out. This does not cost me a cent. The health facility visit, nor the CT scan that the physician might prescribe, nothing. No financial burden to me. Now, in this example, you can see how my environment has shaped my health outcome. First, the physical environment. Although poorly built, that raised step that I tripped over, it resulted in my fall. Second, my social environment, the support system and the social network that I have. My parents, who encouraged me to have the symptoms checked out. And third, our political environment that values healthcare as a universal right for all. Did not have to pay a single cent for any facilities. But if we see our neighbors down south, and I actually did this, I phoned up the Michigan Hospitals and Health Center in Ann Arbor, Michigan, to see if they could give me some price quotes. Because Because in the States, they have barcodes for each one of the services a physician can prescribe. And I guess the first visit, the first service, would be a level 1 checkup. I think I might have a concussion. Price, $158 US. Okay, so the physician wants to make sure it's nothing serious. They want a CT scan. So a CT scan of the head with the contrast, $2,384. And if the results need to be confirmed by the physician, $122 at the level 2 checkup. And those that are not fortunate for medical insurance, which is quite the case because the US does not have a universal public payer system, this cost will have them think twice about getting these services done. That dizziness, that little headache, they could go by with it. And what I'm trying to show here, that these inequalities, the differences in our environment, are just not limited to these kind of physical complications. It's not just a concussion. It's not just limited to the United States of America, and it's not a time thing. This has been going on for centuries. And just to add some context, here is the social determinants of health model that was actually created by a professor here at York, Dennis Raphael, and right now the government of Canada is using it. It's the Public Health Agency of Canada. And what this basically is, as the word would suggest, 12 things that determine our health. And some of them could be health services, the physical environment, like I mentioned in the concussion example, our social environment, employment, working conditions, income, and social status, plus 7 more. And going back to prove that these issues span time, this is a study done by Coop and her colleagues on recessions and suicide rates. So in England, they took data from 2001 to 2011 and tried to find associations between times of financial crises. And they found just that. So the unemployment rate in the US was correlated and associated with the suicide rates. And the same thing with the Great Depression that happened way back. And now, just to prove the second point a little bit further, I wanted to talk about 2 prominent studies in global health. And these studies have really shaped what we understand about public health, global health, on an international context. The Whitehall studies. They're a series of 2 studies. So first, what they did is a bunch of researchers in England looked at civil servants. Now, for those of you that don't know, civil servants are people that work in the public, so people that work in public service. And what they did with these civil servants was they matched their employment rate, so at what rate they were working at, with their health complications. Looked at cardiovascular disease, weight, height, a bunch of different metrics. And what they found is that those that were at a lower employment grade were much more likely to have the worst health complications. The second study happened 20 years later, and they proved exactly the same thing. That our social inequalities do foster health inequalities. So the concussion example, the recessions and depressions, and the civil servants, I think I was effectively able to prove that 1, our environment shapes our health, that 2, social inequalities result in health inequalities. But I have to talk about how health is a privilege and not yet a right. Now, easily with the first 2, you can see how being born into the right conditions, being born into the right environment, will shape how healthy or unhealthy we are. So our health is a product of our environment. And so we are privileged based on the environment that we bring in. That environment is giving us the privilege. It is not a right. And we do have the ability to change our environment. We have the ability to change the world's environment. Is the onus on us at this point to do just that? And I'm going to leave you with that question. When will health become a right for all?